Hi, it's Mark again. In today's video, I'm going to tell you about a treatment that uses a wind instrument to get rid of sleep apnea. Now you might say, is this guy crazy? How on earth can a wind instrument help me overcome sleep apnea? Well, please give me a few minutes of your time and I'll explain how this can help you get rid of your sleep apnea. And it's pretty fun to play too. As you already know, obstructive sleep apnea is caused by flabby throat muscles that fall back and block the air's passage while you sleep. And one of the best ways to avoid this from happening is by toning and strengthening muscles in your upper airway, which is exactly what the didgeridoo does. A didgeridoo what? It might be your first time hearing the term didgeridoo. It certainly was mine when I first came across this treatment a few years back. So, what is a didgeridoo? A didgeridoo is a wind instrument developed by indigenous Australians of northern Australia around 1500 years ago. Didgeridoos are long cylinders, usually over 1 yard or 1 meter, and are made out of branches that have been naturally hollowed out by termites. Modern alternatives to the wooden didgeridoo can be made using simple material bought from a hardware store. I'll explain more about that in a minute. Playing the didgeridoo requires you to vibrate your lips continuously while blowing into the instrument. The sound produced is like this. So, how can playing the didgeridoo cure sleep apnea? Similar to the singing exercises I discussed in my previous video, playing the didgeridoo helps strengthen and tone your throat muscles. When you have strong throat muscles, there is less chance of throat tissue falling back and blocking the airway, so playing the didgeridoo can stop sleep apnea in its tracks. But before you go out and start getting yourself materials for making a didgeridoo, please understand that simply blowing through a pipe is not enough to cure your sleep apnea. There is a special didgeridoo technique called circular breathing that works best for sleep apnea sufferers. What is circular breathing? Circular breathing involves breathing in through the nose while expelling air out of the mouth using the tongue and cheeks. This is the type of breathing you should do while playing the didgeridoo to get the best results for your sleep apnea. But don't worry, you don't need to do it right away. You can work up to it. Now, this treatment might sound so simple that it's hard to believe it works. Kind of like the other treatments I've covered in this course so far, right? Well, like orofacial exercises, covered in my first video, and singing exercises, covered in video number 2, there's scientific proof that playing the didgeridoo strengthens the upper airway and cures sleep apnea. A study conducted by the University of Zurich in Switzerland in 2006 concluded that regular didgeridoo playing is an effective treatment alternative well accepted by patients with moderate obstructive sleep apnea syndrome. The study involved 25 participants with an apnea-hypopnea index between 15 and 30. These participants were given didgeridoo lessons for 25 minutes each day, 6 days a week. After the study, the participants experienced significantly lower daytime sleepiness, significantly improved apnea-hypopnea index, and their bed partners reported less sleep disturbance. Since then, several other scientific institutions have taken notice of how effective didgeridoo playing can be as an alternative treatment to sleep apnea. The U.S. National Institutes of Health states that one of the challenges in the treatment of sleep disorders is poor compliance. Thus, new treatments not only need to be effective, but also be ones that people are motivated enough to use. Didgeridoo playing seems to meet these requirements. Regular playing of a didgeridoo reduces sleep apnea and snoring in people with moderate obstructive sleep apnea syndrome. Dr. Ruben Nyman, a clinical assistant professor of medicine from the University of Arizona, explains, learning to play the didgeridoo is emerging as a surprisingly effective and practical strategy for managing snoring and sleep apnea symptoms. I encourage all my patients with these concerns to discuss this option with their doctors. And even Dr. Oz of TV fame recommends playing the didgeridoo for sleep apnea. He says, those muscles get lax while you sleep, so by exercising them with the didgeridoo, essentially a branch hollowed out by termites that turns into an instrument, you strengthen the muscles so they don't collapse while you sleep. And not only scientists support the effectiveness of playing the didgeridoo as a sleep apnea treatment. In fact, people like you who suffer from sleep apnea have noticed an improvement in their condition. Here's what they have to say. I was diagnosed with sleep apnea about 2 years ago. I went through several different masks and nostril pads trying to find the right fit without success. I often find myself awake listening to the swoosh of my own breathing. And when I did sleep, I sometimes woke noticing I wasn't breathing, waiting for the machine to engage to force air into my lungs, until I finally realized I had better take a breath. After a tired month of trying, I packed up the machine, called my doctor, and asked for a different approach. He referred me to a research article that claimed didgeridoo playing helped a small group of patients reduce their apnea episodes. I figured that if practicing didgeridoo for 15 to 20 minutes a day could reverse my sleep apnea and keep me off that machine, it was worth trying. I ordered my first didgeridoo online. The results have been life-altering. I have more energy throughout the day. I sleep better at night and I dream again. It took about a week of playing 30 to 60 minutes a day. I was a bit of a zealot. I wanted to be healthy again before I noticed a change. I didn't worry about sounding good. I just experimented with sounds and kept the drone going. I eventually learned circular breathing, and that opened up the possibilities. I continued to play for 15 to 30 minutes every day, although I miss a day or two every now and then without any noticeable difference in my sleep. And this was submitted by Doug Nathan. Greg Wasilewski says, my CPAP machine was a problem. There was no keeping it on all night, a pain. Well, I was researching Australia and New Zealand news and found an article describing sleep apnea therapy that cured or reduced apnea. I tried it and it worked. My apnea is gone, my COPD is reduced, blood O2 is up. What more could I want? This works. And Paula Pierce shares her story. Many people have the same problems with sleep apnea that plagued me. I would panic when putting on the mask and ripping it off in the night. Not good. After a little accidental research, my apnea is gone. While looking for Australian news, there was a reference to apnea treatment and the didgeridoo, the funny-sounding instrument played by native Australians. Following up on the reference, there is a treatment for apnea that works. To make a long story short, I played the didgeridoo for about 3 months and asked for a retest of my apnea, and I was found to be marginal. The tech did not find a symptom he could treat, and the apnea mask went into the back of the closet. Pretty amazing, huh? This ancient instrument may look rudimentary, but it works. You only need 25 minutes of practice each day to reap its benefits, and a lot of people think it's a real hoot to play. Compare that to wearing a suffocating CPAP mask throughout the night, or suffering with a dental appliance that makes your jaw ache. Well, that's it for today's lesson. I hope you're enjoying our exploration of proven alternatives to CPAP. And if you'd like to learn more about didgeridoo therapy for sleep apnea, please do visit www.didgeridooforsleepapnea.org. Again, that's www.didgeridooforsleepapnea.org. And I'll talk to you tomorrow in the next sleep apnea treatment video.